After nearly 20 years of working with CT scans, these machines are becoming much more common in dentistry, thanks to decreasing costs and continually improving technology. Similar to a Tesla, upgrades to the software can often be done without replacing the machine. If you don't already own a CT scan, you may be interested in purchasing one for your practice. There may also be times when your patients ask you to interpret a CT scan they bring to you for your opinion. While there's a bit of a learning curve with this technology, with a little bit of guidance, these scans are as easy to read as a conventional radiograph and offer significant more information. This will be the first video in a series of videos to discuss CT scans. This first video will serve as an introduction to this exciting new technology. Now let's get started. Just a little information before we get started about the difference between the medical and dental CT scanning machines. CT stands for computed tomography, and the CT scan used in dentistry uses a cone-shaped X-ray beam, hence the name cone beam computed tomography, or CBCT for short. Unlike medical CT scans, CBCT machines use significantly lower radiation levels while capturing excellent images of both hard and soft tissues of the head and neck. All CBCT machines will display 3 different views, also known as planes or slices, as well as a 3D skeletal reconstruction. Each view shows a completely different perspective of the same area. The 3 planes are the axial, the coronal, and the sagittal. The axial slice is a view from the top to the bottom, or the bottom to the top. So it is essentially a view from the patient's chin to their sinus, or from their sinus down towards their chin. The coronal slice is a view from anterior to posterior. Similar to a panoramic image, it is essentially as if the patient is standing in front of you and looking at you. The left side of the image is the right side of the patient, and the right side of the image is the left side of the patient. The sagittal view is a side view, good for looking at airway and sinuses, and can be very helpful for those interested in obstructive sleep apnea. It will provide a good view of the lingual tonsils, adenoids, and TMJ. And on the upper right side, we have a volume rendering, which is a 3D model representation of the patient's skull, which is helpful for patient education. Well, that's it for the first video. In the next few videos, I will show you how to use the CT scan to identify such things as vertical root fractures, resorptions, and infections. I will also show you how to locate an incipient crack which is beginning to extend down the root, which may ultimately lead to extraction. It's through the use of the CT scan that we can make a more accurate diagnosis and therefore better inform our patient of the prognosis of the tooth before beginning treatment. Thanks, and see you next time.